I am Dr. Woodson Scott Jones. I am the Vice Dean of Graduate Medical Education at the Long School of Medicine, UT Health San Antonio, but I'm also a pediatric professor, and I do inpatient and outpatient pediatrics. Social determinants of health have a tremendous impact on what I do as a pediatrician. Literally yesterday morning in clinic with our residents, we dealt with literacy, transportation issues, food insecurity, economic insecurity, and insurance issues alone in half a day with different patients. And meaning we dealt with issues with homelessness and people having issues with being able to get a formula right now for their children. Literacy issues, not understanding how to navigate the complex matters of getting Medicaid insurance for your child, which is so important for ongoing care. We dealt with a patient being an hour and a half late, but again, the residents asking the question of why and taking that time to realize they had major transportation issues instead of just saying no reschedule. So that's yesterday. It's such a prominent part of our practice. And so as the literature and the studies are beginning to show and have shown, 80% of health happens outside of health care. So if we're not thinking about the social determinants, we are missing a major impact on the health of the people we serve. It is critical for the residents and our fellows in training, while they're in training, to recognize the impact of social determinants for the many reasons I just discussed, meaning asking that additional question, asking those other questions about what might be impacting their compliance. All of those things are very important to ask those additional questions of our patients. Why were they late? To understand, how can we help you with those issues? How do we get social worker, our care navigators, our case managers to help you make it through these barriers to you getting the health care that you need while in training, and as importantly, after training. And so we need to introduce these concepts to them now. They need to be like the residents that I worked with yesterday. They just put a big smile on my face when they came in and they'd addressed these issues and they knew what they were. And then we could go a step further and say, now how do we connect them to the resources they need to make a difference in these patients' lives? That's why this starts now. It actually even starts before they come to residency. We need to make sure we're all on the same page.